Hi, today we're going to be demonstrating how to don sterile gloves, how to don gown, clean gloves, mask, and goggles. We are limited with the supplies that we have, so we're just making way with what we have for purposes of demonstrating knowledge about how to put on personal protective equipment and remove it. So we're first going to start with the surgical sterile gloves. So they come in individual packages. So ensuring first that we perform hand hygiene for at least 15 seconds. We are going to open the sterile gloves packaging, ensuring that we don't touch the inside and contaminate the gloves. So when we open it, it indicates right or left. So you're going to open the furthest away, then the sides, and then the bottom. Okay. So you're first going to, see if I can change the camera here a little bit. So we are first going to apply the glove to our dominant hand. So my dominant hand is my right hand. And using my non-dominant hand, I'm going to grasp with my thumb and my two fingers, and making sure that I don't touch the inside of the glove, the outside of the glove. I'm going to place my hand inside. And I'm going to pull as such. Then using this hand, I'm going to place or slide my fingers towards the inside of the flap of the cuff. As such. And then with my non-dominant hand, place my fingers inside. Making sure that I'm not touching the surfaces, okay? And then they can be adjusted as such, okay? To remove sterile gloves, you're gonna pinch at the wrist, making sure not to touch any skin surface, and bring it forward, make it into a ball, and then using this side, making sure not to touch the outside of the glove, roll the other one into a ball and discard. Okay. Now, as far as donning a gown, the first step would be, again, to perform hand hygiene, and then opening the gown with the opening towards the back. So the first step would be to insert arms through, insert the other arm through, and then pulling up towards the back, and then tying it, adjusting the waist and tying it. Then at this point, before we put gloves on, we would don a mask. So this is making way with, I don't have like the surgical where you tie. So this one is a pre-fitted N95 respirator. So we're gonna place it behind our ears, and we're gonna pinch at the nose and make sure that there's no opening and that it's secure. Then I know that we're not supposed to use glasses as goggles, but we're gonna pretend these are goggles since we don't have any, and we're gonna place them on our face. Then at this point, we would don clean gloves. So we would grab the first, putting our hands through, okay? Then using the other side, and adjusting them, okay? So we are in protective equipment. Now, when we are removing the attire that we currently have, so goggles, mask, and gown, and normally without goggles on, you would remove your gloves first. However, since we are wearing goggles, we first need to remove our gloves. So pinching at the palm, making sure that we're not touching any of our skin surface. Okay, and then using this side and rolling it into a ball as such. Then we would remove our glasses, making sure not to touch any surface or on our eyes, and they would be discarded, or based on policy, we would place them somewhere where they would be sanitized and disinfected. Then next would be to remove our gown. So if I have gloves on, I would just simply pull forward and making sure that it is removed inside out, rolled up into a ball, and discarded. Okay? And then we would remove our mask. And after we remove all of our equipment, we would perform hand hygiene, making sure not to touch our face like I just did behind my ears, until we perform hand hygiene for at least 15 seconds. And that's it.